When it comes to our health, a lot of us aren't all that comfortable with uncertainty. And for people with health anxiety, uncertainty or unusual physical sensations can cause big episodes of severe anxiety. And so what often happens is that people will start to engage in checking or reassurance-seeking behaviors as a way of trying to reduce their health worries. But the problem is, these types of checking or reassurance-seeking behaviors actually have the opposite effect and can cause even more anxiety. So in today's video, we're going to be talking about how reassurance-seeking and checking behavior actually plays a role in causing and maintaining health worries as a way of beginning to understand why it's so important to eliminate or limit these types of behaviors. Now, it's important to point out that everybody engages in checking and reassurance seeking from time to time when it comes to their own health. So the act of checking or reassurance seeking in and of itself isn't a problem. And it's natural to want to check or to want to get some reassurance that some of our physical sensations are benign and not dangerous, as a way of just easing our minds. And when we check or seek reassurance and find out that what we're concerned about is nothing to be concerned about, then we get a sense of relief and we feel better, at least in the short term. But the thing is, we can never get 100% certainty about our health. Just like lots of areas in our lives, we have to accept a certain level of uncertainty around our health because doctors can't test for everything that could possibly go wrong in our bodies. And so no doctor can give you 100% certainty that you're 100% healthy in any given moment. So the danger with checking or reassurance seeking is that we can fall into a vicious cycle where the checking and reassurance seeking gives us a little bit of relief for a short moment in time, but those behaviors actually fuel anxiety in the long term. So think about how this works. Imagine that I have some worry about my health, and so I engage in checking and reassurance seeking from my doctor. My doctor does a few tests, and the tests come back negative, so my doctor tells me I have nothing to be concerned about. So I feel better in the short term. But maybe a couple of weeks later, I start to notice that those symptoms that I was concerned about are still there. And my doctor couldn't completely rule out that there wasn't something wrong, just that the tests that my doctor did came back negative. So now I start to worry about maybe my doctor didn't do the right tests, or that the tests my doctor didn't pick up on an underlying problem. And so now I'm worrying more, and the cycle continues. I want you to imagine that checking or reassurance seeking is kind of like wanting to fill a bucket with water. And so you're pouring water into this bucket, but the bucket has a big hole in the bottom of it. So the water is draining, and you're constantly having to pour more and more water into the bucket, but the bucket never gets full. This is what happens with reassurance seeking and checking. We're constantly pouring more reassurance and more checking into this bucket with a hole in it, and so we never get the relief and the certainty that we want from these reassurance and checking behaviors. The other thing to think about is the message that you might be giving yourself or telling yourself by engaging in constant checking and reassurance seeking. Our minds and our brain will take cues and direction from our behavior. And think about what my behavior with these types of checking and reassurance seeking activities is indirectly telling me. So for example, imagine that I'm concerned about having a cancerous mole on my arm. I've repeatedly gone back to my doctor, who's examined the mole, sent me to a dermatologist. I've had tests and samples taken of it, and everything's come back clean, but I'm still seeking more and more reassurance or certainty that the mole isn't cancerous. Now, if the mole wasn't cancerous, why would I be engaging in all of these doctor's appointments and diagnostic tests? Well, if the mole wasn't cancerous, it would be nonsensical to engage in all of these health checking behaviors. So by engaging in these checking and reassurance seeking behaviors, the underlying message I'm repeating to myself is that this is cancer. They just haven't confirmed it yet. And this is what causes me to feel even more anxious about the mole. So I want you to imagine and think about all of the various ways that we can engage in checking or reassurance seeking around our health or physical status. Things like, poking or pinching or prodding various areas on our skin or other areas of our body. Looking at the mirror and paying attention to any indication of new moles or lumps or bumps or discoloration. Monitoring body processes like repeatedly checking blood pressure, monitoring heart rate using a smartwatch, frequently weighing ourselves. These can also include measuring parts of my body using a tape measure to see if my legs are more swollen than they were last week. I could be paying attention to and examining bodily secretions, like actually examine or looking at my saliva or the color of my urine or if there's any signs of blood or infection in my poop. I might check in with family members or friends or my doctor about various physical sensations, checking to see how normal or how common it is to have the sensation. In an earlier video, I talked about researching symptoms on the internet or getting a copy of blood work and then going to the internet and trying to interpret the results as a way of getting reassurance that everything is normal. This can also take the form of going to online forums and discussing the symptoms that you're experiencing and asking other people for their opinions or thoughts about what you're experiencing. Checking and reassurance seeking can take the form of seeking out medical tests or second opinions or asking your doctor for a referral to a specialist, even if they don't think it's necessary. So there are lots of different ways that we can engage in checking or seeking reassurance around our health or various symptoms. So the first step is to recognize how often you engage in these types of behaviors. One thing I encourage people to do is to carry around a little notepad with them and write down when they catch themselves engaging in reassurance seeking or checking behaviors. Write down specifically what they were doing and what was the context or the situation that they were doing it in. This could also include keeping track of medical appointments and asking friends or family to point out when you seek reassurance or check in with them about your health. One of the things that can happen is that once people start to pay attention to how much checking or reassurance seeking behavior they are actually engaging in, they may be surprised how often they're doing it and how automatic it can become. So just the process of recognizing these behaviors and shining a magnifying glass on them can be an important first step in recognizing their impact. Now, one of the things that makes this really difficult is that we're often told that it's good to pay attention to our physical sensations. It's good to do regular breast exams. TV commercials will tell us that if we're experiencing certain symptoms, check with our doctor. And I'm not saying that you should never engage in these types of behaviors, because these types of health-promoting, checking behavior can actually help us identify problems early on and protect us. But it's got to be within reason. And this is where a person has to ask themselves, when is the checking or reassurance seeking crossing over into problematic behavior? And one way to think about this is that our reassurance seeking and checking behaviors fall on a continuum. On one end of the continuum are people who never check, never monitor their health, never book doctor's appointments, never pay attention to any potential signs of health problems. And on the other end of the continuum are people who frequently and repeatedly check their bodies for signs or symptoms of danger. People who seek out information, make frequent doctor's appointments, regularly talk about health concerns with family and friends, and constantly check on the internet for information about health or particular symptoms. Neither of these extremes is a good thing. and neither of these actually promote physical or mental well-being. Ignoring your body, ignoring signs of potential danger or disease can lead to a person not recognizing early warning signs and ending up with more serious health problems that they could have addressed much earlier on if they had just been paying more attention. But hyper-focusing on health is just going to make you more aware of everything that can go wrong, which can exacerbate concerning symptoms and cause all sorts of other problems. So, for example, if I'm concerned about some soreness in my neck, I might start poking and prodding and squeezing the area around my throat to see if the pain's getting worse. But by frequently poking and prodding and squeezing this area around my throat, this can actually lead to increased feelings of pain or tenderness, which I then might interpret as some underlying condition getting worse. The frequent checking and reassurance seeking can lead to a person booking frequent medical appointments where they have to take time off work to go sit in their doctor's office. They may have to book imaging or diagnostic tests, which can take up lots of time and disrupt a person's schedule. Depending on where you live, these diagnostic tests or doctor's appointments may or may not be covered, and so this can result in significant financial burden for people. And if a person is constantly seeking reassurance or checking in with family or friends about their health and health concerns, this can lead to frustration, irritation, and conflict in those relationships because people just get tired of hearing about the latest health concern a person might have. And family and friends may then label them with unhelpful terms like hypochondriac, which just leaves a person feeling dismissed or invalidated. So the goal here isn't to fully eliminate any checking or reassurance-seeking behaviors, but rather to try to bring those behaviors into the realm of healthy, productive checking and reassurance seeking. To try to get a person into that middle zone on the continuum rather than being on one end or the other, neither of which is helpful. So I'd encourage you to pay attention to and start to recognize any areas in which you're engaging in excessive or disproportionate checking or reassurance seeking around your health as potential behaviors to aim at reducing. And in future videos, we're going to be talking about ways in which a person can actually work on reducing or eliminating these inappropriate or excessive checking and reassurance seeking behaviors, so I encourage you to keep an eye out for those videos. In the meantime, if you want to learn more about how uncertainty can lead to problematic worry about various topics and not just health, I encourage you to check out this video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.